Welcome to A Stride Above podcast, where our commitment to excellence in equine health and athletic performance unites us. Join your host, Dr. Alberto Rullan, as we trot through the essential topics that matter most to you and your equine family members. With over 15 years of experience in equine sports medicine and rehabilitation, Dr. Rullan is dedicated to navigating you through the latest innovations and essential insights in horse health. Together, we'll ensure that you and your horses always remain a stride above the rest.
Hey, today Colton and I are coming back. Make sure you watch a previous episode on EPM because it was extremely informative and we left you hanging in some stuff, right? You know, you want to learn a little bit more about treatments and EPM diagnostics. So today we're going to go straight to it. Let's talk about some of the diagnostics. By the way, did I mention, if you haven't watched the previous episode, you have to watch it, all right? Very, very interesting, very informative. Diagnostic, we were talking about, we have a horse that has neurological signs. And the first thing that comes to mind is EPM or wobblers.
Sure.
Right? EPMs or wobblers. So walk the client through the complicated, frustrating steps of everything they have to go through, unfortunately, in order to solve this case.
Absolutely, yeah.
I'm going to take notes too.
It is complicated, it is frustrating. So that's one of the things I like to start with is explain, hey, we're in this together. We're about to start down a road that's going to be frustrating. It's going to require patience, it's going to require time, and it's going to require some money. Mm-hmm. The next step after trying to set expectations and kind of forewarn the client that it's going to be a little bit of a road that we're going on would be to do full neurologic evaluation, right? We've seen the horse maybe briefly, or the complaint is stumbling or some neurologic deficits. So we kind of know what we're getting into. Now it's time to really evaluate the horse and see what we see if that can help us go down one road or another road with a little bit more clinical suspicion. And
are we going on this same road whether they are stumbling and showing some overt signs versus whether they are showing minor signs such as toe dragging or perhaps just weak behind, etc.? Is it the same process?
More or less. Yep.
Okay.
The clinical exam is the clinical exam, and one of the best ways to do them well is to do them consistently.
Got it. Perfect. So we talked about in the previous episode, we talked about blood work, CSF.
Yep.
A plethora of blood work, and I get questioning probably on a weekly basis. You probably do too. Which blood work do I use? Can you tell us a summary of what blood works are available nowadays?
Sure. Yeah. So there's multiple different labs, and if we're talking about EPM specifically, multiple different labs, and most of them test for antibodies to the pathogen. Being Sarcocystis neurona, just fancy name. We don't have to worry about that. But all that's doing is telling us if there's been previous exposure, right? If the horse at some time in its life has been exposed to the organism that causes this disease. Doesn't tell us about clinical disease. Doesn't really tell us anything other than at one point in this horse's life, there's been exposure. So that's where the blood testing can certainly be frustrating, is because it really doesn't tell us a whole lot. If it comes back flat negative, then okay, great. We can more or less stop going down that route. That's ruled out. Mm-hmm. Rarely does that happen, especially in our area here.
Mm-hmm. And for those of you who ask, hey, what is an antibody? What is an antibody? What is that? Let me give you the best analogy that I have come up with. Best analogy I have come up with is, let's say you are in a war situation and you have soldiers in a field. Imagine those soldiers being the antibody protecting that land, right? So the fact that the soldiers are there protecting that land doesn't mean that the enemy is there.
Exactly.
It just means that the soldiers are there protecting the land because maybe there was a threat in the past, or maybe there was an enemy and the enemy is not there no longer. So the analogy that I use is that the antibodies are the soldiers in the body protecting the body, and the enemy being a virus, in this case a EPM, which is not a virus, right? It's a protozoa, or it could be a bacteria. So the antibodies are soldiers for any organism. And the fact that those soldiers are there does not mean that the enemy is in the body. So the fact that those antibodies are there doesn't mean that the bacteria, virus, the EPM organism is in the body. It means there was a threat at some point.
Great way to explain it. I like that.
Cool, thank you.
Yeah.
All right, so we got those antibodies, and now we can treat. That's one diagnostic, right?
Mm-hmm.
Now, have you ever heard of this new antibody being detected against Fajeri?
Yep.
I recently was introduced to this a couple of years ago by a PhD doctor here in Ocala, actually, and she thinks that this organism is also causing problems. The good thing is that it is fixed with the same medication.
Yep.
That's all I want to say about that. So we got the antibodies detected. Boom. Then, what else can we do for detection?
So for detection of EPM, the other route would be do a CSF tap. So that's cerebrospinal fluid. So that's the fluid that bathes the brain and the spinal cord. You can go in, and you can grab a sample of that, send it in, same exact test that we run on the blood. Again, looks for antibodies. It also, you can do a fluid analysis to see if there's signs of inflammation, infection, etc. So that would be the next step. Obviously, a little bit more specific for the central nervous system. So that's what we're worried about, being affected and infected in cases of EPM. So that can sometimes give you another piece of information along with the blood testing to help you kind of hone in on a potential diagnosis.
Some people hear, hey, cerebrospinal fluid, that's getting in the brain area. Can you tell us a little bit about the ways to do it, safety, concerns, etc.?
Yeah, absolutely. Yeah, you're going very close to the brain area. You're going right next to the spinal cord to collect the sample. Some clinicians do it laying down, general anesthesia. Obviously, there's a risk with any general anesthetic procedure, very, very low now that we've gotten so good at doing anesthesia on horses, but the low risk still exists. Some clinicians do it standing, so standing, sedation, ultrasound guidance, and that's how we do it here, and we've had good success, good safety, gotten good samples. But anytime you're sticking a needle in a horse, especially when you're going next to something very sensitive like the spinal cord, there's a risk associated with it, but with practice and competence, you can minimize that risk.
Yeah, I agree, and I think that there was a report of perhaps some hematoma developing on the standing CSF tap at some point. I have not seen that. I haven't had that complication yet, knock on wood, right? We haven't had it, but it could also happen laying down.
Sure.
Doesn't mean it's only on the standing horse, right?
Absolutely.
So I like the CSF tab also because it's a little bit more specific and more sensitive, right?
Agreed.
Than just the blood. Some clients have the hesitation of going in the spinal cord, but in our experience has been fairly safe, especially if the horse is not extremely neurologic, wobbling, laying down, if he can stand fairly still.
Mm-hmm. Yep.
Yeah. So now we have talked about antibodies, we have talked about CSF tab. Now, some people, very fairly, especially when I used to work up north, they were, let's just treat. Doesn't matter if he has EPN or not. It's fairly done all throughout the United States, and I have some clients that like to do that. What are your thoughts? There's no right or wrong answer for this. What are your thoughts on that?
Yeah, no, there is no right or wrong answer. And I, like you, have many clients that some of them don't even want to test. Say, no, you don't even need to pull blood on them. Let's just treat them. With that, I just try and have a conversation with them without getting a diagnosis, which we now know by now that can be frustrating, difficult, and sometimes impossible to do. But we're kind of shooting in the dark with our treatment. So spending money on medication that might not be needed. Very safe medication, but all medications have some potential for issues. And then there's always the conversation that we have mostly with antibiotics of antimicrobial resistance. If we're treating all these horses with these antiprotozoal drugs, which we only have a few of, are we selecting for resistance to those drugs? Are we, 15 years from now, if we continue practicing the way that a lot of clinicians are, and again, no right or wrong answer here, are these drugs still going to be effective down the road?
Good point about the antimicrobial resistance. Another fair warning that I think we should bring to the topic is that last research I read, they were all about 60 to 66% effective. So the fact that you blindly treat for EPM, if it doesn't work, just by statistic, you have about 30% chance that it doesn't work.
Yeah,
right.
Really so doesn't tell you anything.
Now you're still wondering, hey, was it EPM or wasn't EPM? So that now you are at 30% chance. So what do you do now? You either test or go back to another product, and then you can continue with that cycle for a very long time. Yeah. Very long time. It can be very frustrating. And before we wrap it up, because we're almost out of time, another thing to consider, if it's not working, the treatment, it's time to, for sure, do diagnostics, whether it's neck radiographs, myelogram, CT scan, find out what is causing the problem.
Agreed.
Well, our time is up. Make sure you watch our previous episode and stay tuned for our next episode on EPM. You have a fantastic day.